Prevent Blindness Focus on Eye Health podcast with host Christopher Hord and guest Donna Fishman.
Greetings. Today, our guest on the Prevent Blindness Focus on Eye Health podcast is Donna Fishman. Welcome, Donna.
Thank you. Nice to be here.
Now, to get us started, first of all, why don't you tell us a little bit about what you do?
Sure. Thank you. I'm Donna Fishman. I am the director of the National Center for Children's Vision and Eye Health at Prevent Blindness. Been here about 7.5 years, and I work with all of our professional training programs, our education programs for parents and families, public awareness, data analysis, and a variety of other projects for children's vision and eye health to help children see more clearly and have their best possible lives.
My goodness, that's a pretty significant portfolio there.
Great staff.
Good. Can you tell us a little bit about how you got involved with the center?
Sure. Well, I have a background. I had about 35 years in the field of public health, working on a variety of issues from adolescent sexual health to healthy foods in schools and asthma prevention in schools. So I've always worked at the intersection of schools and public health and learning for children. And I had directed a school nurse leadership training program, and one of my advisors had recommended me for this job. And certainly in this job, one of our key audiences is school nurses because they could perform the bulk of vision screening along with our friends at Head Start. That's another key audience for us.
Okay, thank you. Now, speaking of some of your main audiences, the nurses and the folks in Head Start, my understanding is that there is going to be a training program that will be starting up sometime soon that healthcare professionals and allies might be especially interested in. Can you tell us a little bit more about that?
Yeah, thank you. I would love to. Prevent Blindness has run the Children's Vision Screening Certification course for many, many years. And so we've actually just given it a complete overhaul. Our course is very interactive. And so we have a new learning platform, and the course is self-paced modules. There's 15 modules covering an enormous amount of topics I can talk about, everything from the anatomy of the eye, how the eyes work, how children learn to see, what are common vision conditions for children at all ages. Our course used to be just for preschool and school age. Now we go down to birth because vision screening can start at birth. Vision screening, as many people watching know, is a really important public health measure to identify children at risk, but it's not the only part. It's not just how you do a vision screening, although that is a big part of what the course is. How do you actually use different vision screening tools to assess children's vision and make those referrals to eye care? It is also about helping families understand the importance of vision to learning, to academic achievement, and then helping families actually access the eye care. And helping families navigate to get to eye care is an important part and a new part of this course. It's a whole module also about children who should bypass vision screening, who might have some special needs, which make them more likely to need an eye exam. And so we have a lot of protocols in this new course and a lot of new information, interactive learning. And then our course has always had and continues to have what we call a personalized, individualized mentoring session so that people who take the course, our learners, can demonstrate their skills to one of our expert trainers and tweak their vision screening skills in a variety of tools to make sure they are doing the best, most evidence-based screening for the children that they serve.
Okay. All right. Thank you. And while we're on the topic, first of all, let me ask, because I'm sure our listeners who are especially the healthcare professionals, but also other allies who might be interested in this, what are the benefits of certification?
Thanks for asking. There's a lot of benefits to certification. One of the reasons that we certify shows that you have taken this class and you have learned from national experts at the National Center for Children's Vision and Eye Health at Prevent Blindness how to conduct an evidence-based vision screening. It is a 3-year certification, and then you must take a recertification course to make sure your skills are still up to date and you're doing the vision screening correctly. And so it helps us create a uniformity around the country. So when we have our certified vision screeners, it means they've taken the whole class, passed all of our knowledge checks, and then had that individualized mentoring session so that we know that we have thousands of people across the country now performing the same kind of screening, which we know will accurately identify children who need eye exams. And that's the benefit of getting that certification.
Great. And I'm sure some of our listeners may recall we had a news item a few months back about Prevent Blindness Texas, working with the Fort Worth School District volunteers to do screening, who's helped screen thousands of children in the city. Because of the sort of benefits that this program can have, what is the best way for folks who are interested in getting involved? What would be their first steps to get more information and to possibly apply?
Thank you. That's a great question. And I'm so glad you brought Texas up because all of our Prevent Blindness affiliates run children's vision screening certification courses. And so we have links on our website to go to those states. So some states have their own programs, including our affiliates, and then some other states also have their own programs. And so we want to make sure that people are registering for our course only if their state does not have their own course. So our affiliates do a fabulous job with screening and with teaching this course and then deploying out thousands of volunteers that are conducting thousands and thousands and thousands of vision screenings every year, up to about 6,000 among all of our affiliates in our 6 states. And so most of our information is all actually on our website, nationalcenter.preventblindness.org. And as you are on the menu, you'll find Children's Vision Screening Certification course. And that's where the information is. And that's how you can then sign up for and pay for the course. We also do offer group discounts. And so you can reach out to us at info@preventblindness.org.
Fantastic. And that brings us around to something I definitely wanted to ask. I don't know about you, but when I get tons of emails about different offers and opportunities, I get frustrated sometimes because people don't ever talk about how much things cost. And I know some certification programs can be terribly expensive. Can you give us an idea, people who want to enroll in the course, what kind of expense are they looking at?
Sure. Thanks for asking. So we've had the same pricing structure now for about 8 years. And with the new course and how expanded it is, we're actually going to be increasing the cost. For individual learners, the cost will be $225. We will have a special once we launch the new course. Next month, we're going to be having a discount, and you'll see that on the website once the course is launched mid-March through June 30th. And then the course will be $225. So it'll be a little less before that. And then we have different pricing for groups depending on how many learners you have in your group. And again, we'll be happy to give that information. It is a great value. It's also 5 professional development hours, and people need that for their own professions sometimes. So as I said, we have a lot of school nurses. We also have Head Start, other early childhood providers, and then we have folks who work in medical clinics, both in private medical clinics and community health centers or federally qualified health centers. And so people come from lots of different places to take our course and make sure that the children that are being screened are receiving an evidence-based vision screening.
All right. Now, one thing I did want to ask for our listeners who are not necessarily in the healthcare profession, but especially parents and family members, caregivers, and things like that. I'm sure some of those folks would like to know more information about this.
We have a terrific resource for parents and families. It's called the Small Steps for Big Vision. It is a toolkit for parents and caregivers. It again is on our homepage of nationalcenter.preventblindness.org. And from there, you will see it on the menu, the Small Steps Toolkit. And we have 40 plus handouts specifically geared toward parents, for those who work with parents who are professionals in whatever field, teachers, social workers, whoever else may be, or volunteer groups. We have a scripted PowerPoint presentation to provide information for parents. So information ranges from what's the connection between vision and learning? What is the connection between classroom behaviors and vision? How do you make an eye care appointment? If your child has a vision screening and then needs an eye exam, what are some questions to ask the eye doctor? If your child gets glasses, what are some books that you can read with your child about glasses? So as I said, 40 plus handouts that covers the whole gamut. And then also on the Prevent Blindness website, www.preventblindness.org, if your child is diagnosed with a vision condition, there are fact sheets on many childhood vision conditions, including amblyopia and strabismus and the refractive errors. And so we have information kind of on the screening side, parent education side, and then on all the different vision conditions.
Fantastic. All right. Now, let me just ask you, is there anything that you would like to mention about the center or the training courses that we have not touched on today?
Oh, thanks for asking. I think for people to know that we have these resources and that some states do require vision screening for preschool children, about half the states, and then about 60 to 70% of states require vision screening for school-age children. And so it's important to know your state laws and when your child will receive a vision screening in a school or childcare setting. And also as part of child exams, which kiddos get, of course, often during the first year of life and then annually. Vision screening should be part of that child exam. It is recommended by the American Academy of Pediatrics, which we're so thrilled about. So children have multiple opportunities to have their vision checked. And we always talk about their visual acuity and how they see and how well they're using their vision to see the world around them, to be able to see the classroom, see the board, learn to read up close, do math problems. And so there's lots of opportunities for children to have their vision screened. And I will say that we all need to be advocates. So teachers need to make sure to go to the school nurse and say, this child is having a little trouble reading. I'm noticing they're kind of turning their head slightly when they're trying to look at a page, and bring those concerns. One of our handouts that is the most used is called Signs of Possible Vision Disorders, which includes what we call our ABCs: appearance, behavior, and complaints. Children don't know they can't see. They think everybody sees the world the way they see the world, and often their parents don't know that they are unable to see the world with 20/20 vision. So we want people to be more aware. We have a great fact sheet we developed called Think of Vision. And it's a great way to say just a real easy list of if the child has some of these kind of complaints or appearances of their eyes, get their eyes checked. Vision screening, it assesses risk for a possible vision disorder, and then it indicates when a child would need an eye exam. And so we want to make sure that parents and families have the best possible information they can about their child's vision and know where to go and how to find an eye exam when necessary.
All right. Fantastic, Donna. This is great information, and I'm sure a lot of our listeners really appreciate it. Now, let me just double check. Did you say that the new course is going to be starting in March?
It should be up by middle to the end of March, and we'll be promoting that widely on the website and through all our newsletters. So hopefully our listeners will get that information as soon as our course is launched.
All right. So that is coming out in March, and there will be an initial discount. So keep an eye out for that,
And
folks.
a discount. Absolutely.
All right. Well, thank you for joining us today, Donna.
Thank you for tuning in to the Prevent Blindness Focus on Eye Health podcast. To learn more, please visit preventblindness.org.